Okay. All right, hello everyone. Dr. Rich Castellano here. We're here today with Dee. How are you doing today, Dee?
Good.
Getting some ice done around the lips. All right, we're going to take the ice down for just a moment. We're going to show them. So we're going to be doing some lip wrinkle treatment here, and the ice is great to help with numbing and reducing of bruising. So Dee is here to treat some of the wrinkles around the lips. And so we're using some of the hyaluronic acid fillers. We'll also do some in the chin. When you see creases like that, those respond very well to a no downtime treatment of the facial fillers. So I'm Dr. Rich Castellano. Hello, Dr. Sadik. Thanks for joining in. And we did some numbing medicine already for Dee, and we were doing some of the fillers, and she was so kind to allow us to do some teaching and do some video. And so Dee, we can tell them how young you are, dear?
Yes.
Dee is 87 years young. 88, and she is still going strong. And so, why don't you rest your head all the way back for me, dear? So we already, what I did, you can set the ice down for just a moment. I did a dental block, and I did just a few little injections through here, and we did some numbing. But now what I'm trying to do is just chase some of those creases. Elise, can you just see if you position those cameras? Yeah. So today I'm using some of the Bellatero as a hyaluronic acid. Okay. And then on that one with the plus when it's ready.
Yeah, yep.
And so now what I do is I just try and go right superficial into the skin. Dee, do you feel a little bit of a pinch here, a little pinch?
Yeah.
So she's numbed up pretty good. But what I'm really trying to do is just be as superficial as possible, and then I go for every crease that I can find, and I just try and flatten that out as much as I can, a little bit in the lip. Do you feel a little pinch there? I really prefer to do the dental block, which is an injection here, 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 and here, and it's just much easier to do. And you can skip Shino, but do the other. Oh, that's fine.
Sorry.
And then this one is everything's looking good. So this is what hyaluronic acid fillers can do. They can treat some of the fine lines and wrinkles, and you can even do this over multiple sessions. So just putting almost a, let's say 0.02 cc's, just a very small amount. And this is an intradermal injection. Now you can also use this deep for plumping, but the HA fillers, it's better to use something like a Radius or something that'll last longer. Bellatero, Sculptra, Bellafill rather. So now where we have the sun damage to her skin, and instead of doing laser treatment, this is a very acceptable alternative. I'm going to try and feel a little bit in the oral commissure here. Little pinch there, so I can tell she feels a pinch. So we'll go slowly there. Now the beauty, I like to use the cannulas, but for these areas, I'm using the needle because the needle is best for these fine wrinkles. Dee, do you feel a little bit of a pinch here, dear?
Yeah.
Dee is very active, and patients will tell me, they say, oh, I'm in my 60s or 70s. They say, whatever treatment they do, they say, when I'm in my 80s or 90s, they say, I won't care. But we still care about our appearance. Dee has many active years ahead of her yet. Do you feel a little bit of a pinch here?
No.
Okay, good. And of course, we want to make sure she's comfortable. So this is one syringe. I'm going to use one more just because I want to try and fill as many of those creases as possible. Hello, Paul. Thanks for joining in. Good to see you. So a little crease here on the lip, and I'm just really trying to thicken the skin through the dermis, and those creases get softer. I never use the words gone, take away, or get rid of, but we want to improve them as much as we can. Very good. How are you doing, Dee?
Good.
So this is another syringe. This is the Bellatero Balance, but there are, let me put that up, it may be backwards in the Facebook video. There are many different hyaluronic acid fillers. Please follow us on Facebook, and we're also on YouTube. You can find us there where we post videos. We're going to be hosting videos interviewing other doctors as well. So you want to see that content and learn what the latest is in cosmetic procedures. It is amazing how the technology keeps advancing. And some of the new technology actually even works, but some of it doesn't. That's why you want to hear from the experts on what is popular, what is falling out of vogue. A little pinch there. She feels a pinch. So I'm going to feel a little bit in the oral commissure. A lot of these little creases, I'm going to try and thicken the skin around the chin as well. Some people call that the peau d'orange, like the orange peel. And so we're filling those areas in. It's not the most flattering way to describe our chin, but that's one of the technical terms that we use. Hello, Jeff. Thanks for tuning in. For those of you just joining, I'm Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon. We're doing fine line filler treatment. No downtime. Bruising can happen. If you bruise, you can cover with makeup, or you can use the Arnica Montana. Dee, how are you doing, dear? Dee is 88 years young. Now, because I did the dental block, her lips will be goofy when she talks, so it'll be fluff, 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 you know, and, right. And that'll go away. That will go away. But already we're getting some nice softening of a few of the creases. And if we can make it better, we can try and prevent it from getting worse. Of course, it's never too late to do sunscreen, sun protection. But this is a very simple strategy to treat the fine lines and wrinkles. And we're glad that you could watch with us today and share. The most important decision you make about your cosmetic treatments is who is your artist? Who is the doctor taking care of you? Okay. Very good. So I'm going to do a little bit more here in the chin, and I'm just trying to find the most noticeable, the most obvious creases that you can see them almost filling out little by little. And if you do laser resurfacing is going to be 7 to 10 days you don't want to see people. And there are some of my patients, they just won't do that kind of recovery. So that's where this comes in as a viable alternative. Feel a little bit of a pinch here. 1, 2, 3, pinch. So these are intradermal injections. Pinch. We have our 4 categories for the face to improve the appearance. If we sag, we tighten. If we lose volume, we fill. If we get sun damage, wrinkles, and sunspots, we polish and repair the skin. And hi, Karen, how are you? And the 4th category outshines everything else. That's our behavior. And none of my treatments look as good as when we put a smile on our face. And Dee certainly knows the power of smile. She's a good smiler. She's a good smiler. Hi, Karen. Yes, you can do this to plump the lips. And I am doing a little bit of lip plumping when I go through this area. But I'm really just focusing on, you can see some of the sebaceous hypertrophy in the skin, and that's just a fancy word for you see little tiny bumps in the skin that make these folds and wrinkles, and if we fill in the intervening areas, you get a little bit more evenness. So I like to do some massage as well. You can't really hurt the filler. Hi, Courtney. Hi, Marisol. Good to see you. Thanks for joining in. Everything's looking good. So we're filling fine lines and creases, and we go right along the lip line. Dee will pass the grocery store test today. If she walks into the grocery, no one's going to do a double take. Fillers are the future of plastic surgery because there's no downtime. They work, they get great results. We have fillers for fine wrinkles, we have permanent fillers, so that's why it's just more popular today. People are choosing the fillers. So a little simple treatment. Hello, Akash. Good to see you. We're so excited for Akash. Going to become our next county commissioner. Happy to support him. All right, so just a little bit left here. So Dee, we are all done. And you might see little pinpoint areas of bleeding where we do the injection. And then that fades away. And I see a little redness there. I don't see any big bruising, but bruising can come later. So let's take a look. Why don't you take a look here? Can you see how we filled in a few of those areas? Okay. We want to soften. Now the hyaluronic acid builds some of it draws water in. So even over a few days you may see some changes. So what I like to do is that 1 month we will take some additional pictures. So you look at her lips now, and then you look at her pictures from before, and you see how we can get a little bit of softening across the top